Okay, so this is case study for chapter 70 and 71. My name is Melissa and my group members are Jessa and Patricia. We are group A. So chapter 70 is the review of the immune system. The nurse is preparing to perform allergy testing by intradermal injection of house dust, molds, foods, and other common allergens. Number 1. Why are injected extracts called antigens? An antigen is a molecule that triggers a specific immune response and then becomes the target of that response. Injected extract works the same way as an antigen by stimulating a specific immune response if the person is allergic to a substance. Number 2. The allergic reaction causes degranulation of mast cells. What cells respond in the skin? What do they release? And what dermal symptoms will the patient have if allergic to the antigen? Mast cells are derived from basophils and are concentrated in the skin and other soft tissues. They release histamine, heparin, and other compounds that cause symptoms of allergic reactions. If a patient is allergic to an antigen, they may experience swelling, edema, or inflamed or red skin, which is also called erythema. Erythema. Number 3, the patient is required to remain in the office for 20 minutes after injection of any antigen because that is the usual time frame for an immediate hypersensitivity reaction. Describe what the nurse should do if the following reactions occur. A. Itching and redness at the site of injection. If itching and redness occurs, the nurse should record the reaction and explain to the patient how to use ice and OTC antihistamines to relieve the symptoms. B. Tingling around the mouth. The nurse should assess the patient's airway and breathing if tingling around the mouth occurs. The nurse should also identify if the patient is having an anaphylactic reaction to the antigen and prepare the necessary medication to administer if an allergic reaction is happening, such as epinephrine. Number 4, why is it important to teach this patient about possible anaphylaxis? The patient may have delayed allergic reaction once they leave the office, and they should be aware of what to do in case an anaphylactic reaction occurs. Chapter 71, Childhood Immunization. The first case study is parents bring their 7-month-old child to the clinic. They state that they were told by an emergency department physician of the local hospital to bring their child in for baby shots. The parents are concerned, stating that they have heard that children can die from these shots. Number 1. What teaching can the nurse provide about the safety and benefits of the immunizations? Vaccines are generally very safe, although mild reactions can be common. Serious events are rare. The risk associated with contracting the diseases without immunizations far outweigh the risk of the immunizations themselves. When individuals remain unvaccinated, the likelihood of preventable diseases spreading increases. Individuals who are immunosuppressed, such as patients of immunosuppressive medications, and cannot get live vaccinations can also benefit from immunization. Vaccinations prompts the body's immune system to create protective antibodies that target the specific germ for which the vaccine was designed. This helps strengthen the body's natural defenses and enhances its ability to fight off infections effectively. Number 2, the parents have difficulty understanding complex concepts. How can the nurse explain reactions to immunizations? Side effects from live vaccines can seem like the actual illness and happen after the typical time it takes for the disease to show up. It's not suggested to use acetaminophen or NSAIDs to stop or decrease minor adverse effects because it might weaken the immune response. Answering questions about the child's health and allergies thoughtfully can stop many severe side effects. Number 3, how would the nurse explain the laws requiring children to have immunizations before they can attend school, and in some cases, daycare? The law requires children to have immunizations before they attend school or daycare in order to prevent the spread of diseases, as well as protect the child and school. The pediatrician can give school the required documents if a child can't get vaccinated for medical reasons. If a family's beliefs oppose vaccinations, a parent or guardian should fill out and sign a form for the school nurse. Number 4. What subjective data and medical history does the nurse need to review before administering an immunization? Medical history, including allergies, past vaccine reactions, and any conditions that weaken the immune system, along with medication history, sexual activity, and the possibility of pregnancy for girls who have started menstruating and receiving blood products or immunoglobulins in the last 6 months. Case study number 2. Parents of an elementary school child in Lancaster, Pennsylvania, have verbalized to the school nurse that their children have never been contaminated with immunizations. The parents state that their unimmunized child has not contracted the measles, mumps, diphtheria, or other illnesses for which immunizations are routinely administered. Number 5. How should the school nurse respond? The school nurse should respond by explaining that unimmunized children who haven't contracted the disease haven't been exposed to the virus. Most of the children in school have been vaccinated. Vaccinated children aren't carriers of the disease. If the unvaccinated child was exposed to an environment with poor sanitation and a low rate of vaccinations, then the child will be at risk for infection. Number 6. The parents state that they are particularly concerned with MMR because of its association with autism. What has research suggested about the association of MMR and autism? There is no evident link between MMR and autism. This misunderstanding comes from the timing. MMR is administered after age 12 months. Symptoms of autism are recognized right after, and that's where the false association comes from. Current vaccines contain little or no thimerosal. Number 7. The school nurse is aware that exposure to certain populations or situations puts unvaccinated children at risk for contracting vaccine preventable disease. What are possible populations and situations that would put children at risk in this school or geographic area? The Amish population do not believe in vaccines. Being exposed to this population will put you at risk for contracting vaccine preventable diseases. There are other groups like the Amish and people from other countries that do not mandate vaccinations. Natural disasters such as floods and any situation where overcrowding or sanitation is an issue. Being vaccinated serves as a protect against these diseases. Case study number 3. During pharmacology class, a nursing student remarks that he would not have his 11-year-old daughter receive human papillomavirus vaccine, or HPV, because she is a good girl. Number 8. What should be included in this discussion about the parent's reaction? We should let the parent know that vaccines are meant to protect those who have not been exposed to the pathogen yet. They should not feel definite that their child would avoid activities that could expose them to this virus. The child's behavior is not predictable. It is better to feel definite that your child will be protected from the virus. The vaccine has minimal adverse effects, so getting it won't cause any harm. Number 9. The concerned parent or nursing student agrees with the explanation, but states that his daughter has heard that the injection is painful. What might the parent discuss with the pediatrician about this concern? The parent could request for local anesthetics and use relaxation techniques to reduce comfort. Administer the vaccination in the non dominant arm. Acknowledge discomfort and give positive affirmations for overcoming it. Number 10. The literature reports a number of adolescent patients fainting when given the HPV vaccine. What might contribute to this reaction, and what can the office nurse do to prepare for this possible reaction? The fainting is more likely due to nervousness or from the pain. It is best to position the adolescent for safety. Allow her to remain lying for 10 to 15 minutes after the injection because fainting can happen after the injection. Number 11. Another nursing student states that she will have her daughter vaccinated because the adolescent will not have a pap smear and pelvic examinations until she is ready to get pregnant. What should be included in response to this statement? Extra precautionary measures should be done because the vaccine does not protect from all strains of HPV that cause cervical cancer. Females who are sexually active should have regular gynecologic examinations. A vaccine won't work on a person who already has a virus in their body. And that is the end. Thank you.